Hello and welcome to our first bowel care series session, Pressure Injuries. I'm Scott Chesney. I'm so happy to be with you today. And joining me today is Beth Householder, who's with Quest Healthcare. How are you today, Beth?
I'm great. Thanks for asking.
Hello and welcome to our first bowel care series session, Pressure Injuries. So here we go. Sorry, I just had a little feedback on the back there. So before we dive into our discussion, here's a quick update from the Thrive community, creator and sponsor Enemeez. So I'm going to share our screen right here. And here we go. And so here we are. Beth, take it away.
Hi, everybody, and welcome to the Thrive Facebook series. Today, we're going to talk about pressure injuries, as Scott mentioned, but just a word about Enemeez. I'm hoping you're familiar with this low volume mini enema made of docusate sodium. It is both, there's two tubs here. One is Enemeez Plus, which contains benzocaine, which is fantastic for patients with spinal cord injuries of a T6 or above, because with the benzocaine, it helps minimize the chance of autonomic dysreflexia. And Enemeez regular is great for all those other patients for both general constipation and those with neurogenic bowel. So we've been around for over 15 years helping both the VA as well as model spinal cord injured facilities and top CARF facilities to establish better bowel care protocols using this product, Enemeez. And I'm going to hold it up just so you guys can see the size of how small and convenient and easy to use it is. And it works fast to evacuate that lower sigmoid colon in just 2 to 15 minutes with zero mucosal discharge and virtually no fecal incontinence. And that's the real message today, Scott, is that we're trying to help everyone stay dry as much as possible and move their bowels on a regular basis, a predictable time of evacuation, so they don't risk further pressure injuries. And then please, I'd love for you guys to try it. We are offering a 2-week free supply of this mini enema or Enemeez, either enemas or Enemeez or Enemeez Plus. So jot that down and reach out to us, and we'd love to see if you find it works well for you.
And Beth, I have to say, before we get into our program on pressure injuries, I'm like the hair care for men guy. I actually host this program, but I've been a longtime user of Enemeez, and I wouldn't put my name behind anything unless I really felt that it worked. And it's almost seamless. So when they say 2 to 15 minutes, they're absolutely accurate with that. And it's just part of a routine now. And it's no nonsense. It's direct. It does what it needs to do. So a big fan over here. But let's now jump into our program. How do we? There we go. Wait a minute. Hold on. What happened to our PowerPoint? Hold on. Let's share.
All right.
Oh, here we go.
Perfect.
No,
Perfect.
hold on. Wait. No. I'm going to tell you what happened, because this is where it happened. So we have it at the end for you as well. So that's why that came up again. I was like, we're not at the end of the presentation. Where did my PowerPoint go? But this is all part of doing things virtually. You have these issues, but we're going to get into pressure injuries. And before I hand it off to Beth, anyone who's out there, whether you're paraplegic or quadriplegic, and we'll get into all the different areas too that you have to relieve pressure from. But please, this is something that you do not want to take for granted. You do not want to be hospitalized. You don't want to say, well, I've gone 5 years without a pressure sore. This is something from checking your skin to repositioning to doing so many things is so important, because I will tell you this, is that the result, if you don't, you're looking at a hospitalization. And I don't mean to scare anybody out there, but you could be really looking at some significant time, whether it be in the hospital or other places, that's going to take you away from everything that is part of your quality of life. So please take this seriously, whether you're someone who's newly injured or someone who's been paralyzed like myself for maybe a few decades. So Beth, tell us a little bit more about pressure injuries. Take us through the basics.
Sure. So how can you tell if you have a pressure injury? As it says here, pressure sores or pressure injuries always develop over a bone, where the back of the head, the shoulder blade, the hip bone, and frequently the coccyx meets the bed. It is from direct pressure. And if you're not moving on a frequent basis, we do recommend every 15 minutes you shift your weight. But according to Johns Hopkins, if you don't shift your weight and you're not getting circulation and blood supply to an area, body tissues can die in as simple as 2 to 3, as short a time as 2 to 3 hours. So the first stages would be, that it's reddened, discolored, and darkened, and might be warm to the touch or hard to the touch. And if you push on it and the color doesn't come back in a few minutes, it's a first early sign of a pressure injury.
And some of you out there might be wondering where your coccyx bone is and everything. That's your tailbone. That's the main part. That's where your spine goes all the way down. And that's what she's talking about. And that's absolutely a place that you can get a sore. And what are the two bones that we sit on the most, where we develop sores as well on your bottom?
Like the sacrum or the
sacrum,
coccyx back there?
Yeah, but the two almost like underneath your legs. If your legs were going to be extended, I'm trying to think. It goes down a little bit further. Those two bones on either side.
I'm not exactly sure. Forgive me. I do not know.
No, forgive me as well. We should know them, but I'm saying get off the pressure. Give yourself relief. So let's move on to the first one.
Yeah, so pressure injuries are really designated into 4 stages, and there is some unstageable aspects as well. But these are the early signs. If it's, again, red or discolored and your skin isn't broken, this is considered stage 1. The key to this is to get off the area, to offload the weight, and keep that area clean and dry. See what Scott's doing right now? You want to offload that weight as much as you can. Every 15 minutes is really recommended. But if you do start developing that pressure injury, you really have to offload for 2 to 3 days. And if it doesn't respond, call your healthcare provider at that point. So that's stage 1. Let's go on to the next stage. Okay, here's stage 2. If this is when the top layer of the epidermis is broken and it's starting to create that shallow open sore. And sometimes the second layer, the dermis, is also broken. You may see drainage, fluid leakage may or may not be present. But again, most critical is to offload that pressure, to get off the pressure, and again, follow the steps that we just talked about, and get to your healthcare provider right away, because now pressure injuries can go from stage 1 to stage 4 very rapidly. So we really need to take action. Again, the key is really prevention. But if you're at stage 2, it could take anywhere from 3 days all the way up to, Scott, 3 weeks. So you really need to take this very seriously.
So Beth, I'm gonna jump in here real quick, because obviously you saw me do a reposition, which I can do. I'm a paraplegic, and I know there's some quadriplegics that can do that. And you really want to hold up there for a while. And I know it tires the arm and so forth, but you really want to create a significant amount of time. You'll get a good workout to your arms. But I also want to be respectful to my extended brothers and sisters who are tetraplegics, quadriplegics. And while you might not have that arm strength to be able to do that, it's very important, if you have a power chair, to tilt in your power chair so you go on your back for a little while. And I know some of you actually like to take naps when you're in that area. Any place, though, where you have to be careful is that if you end up going on your back for too long, you could develop a sore there. You also have to watch if you have a headrest and you want to relieve pressure there. So if you can do all those on your own, fantastic. If not, you absolutely should have a caregiver who should be well aware of your skin, the discoloration, and checking it at all times. I'm a big proponent on, if you can, to check your own skin first thing in the morning, and also before you go to bed, and any other time where maybe there was some a transfer that was awkward or something that happened where you might have created some kind of either a cut or a sore could be forming from having sat up too long in the middle of the day, whatever it may be. If you can check your own skin, please do it. If not, and this is where we have to be vigilant with regards to our caretakers and caregivers, is that while we might not be the ones who are actually doing the checking of the skin, we have to inform the people, listen, did you check this? Did you check down by my ankle? Anywhere there's pressure, especially where you don't have feeling, is that make sure that it's being checked and it's being checked constantly.
Well said. Well said. Now, we hope you haven't experienced this yourselves, but if you have, this is getting quite serious, a stage 3 pressure injury. This is when the wound extends through the second layer, the dermis of the skin, into the fatty tissue. Bone and tendon muscles have not yet been affected. That would be stage 4. So for this stage, if you're seeing any signs of infection, whether there's redness at the edge, sore, pus, odor, greenage, drainage, and you may even be experiencing fever, and you might see signs of dead or necrotic tissue. This is very serious. Get off the pressure right away. See a healthcare provider. You will need wound dressings at this time, and a special bed and pressure relieving mattress, which you probably already are using. But healing time can be anywhere, unfortunately, from 1 to 4 months. So this is a serious stage.
And you also want to be aware, and that's why I love these slides, because they have the healing time. I hope, I don't like to scare people, and I know Beth doesn't like to scare people too often, but you looked at 1 to 4 months, that's a long period of time. And if it's something that's preventable, that's where the bigger frustration comes in. It's not like something just happened because I got sick somehow and I don't know how. But this is something because not taking care of our skin, not doing what we need to do to prevent this. Obviously, we want to do everything to care for it, but the preventative measure is important. So just look at those numbers, 1 to 4 months. And again, the more severe we get, the longer period of time we're talking about.
Yeah, and Scott, you mentioned that prevention. Again, if we move our bowels well daily or every other day, then it helps not to press on your bladder and can minimize urinary incontinence. So again, it's if you can do that and do it well, that will really help you. And then should you start to see a IAD, which is inflammation-associated dermatitis. That's always from when the skin lays in moisture, Scott. If you're starting to see that rash, you need to address that right away. I know I've talked to my nurses friends, they use zinc products. There's also a great drug called Allicane Plus out there that our company makes, and it really can help heal the skin and prevent that rash from developing and causing other issues. So moving on to stage 4, this is really quite serious. The wound now is extended into the muscle and can be even as far down as the bone. There's usually a lot of dead tissue, drainage, and a high risk of infection. Actually, people don't realize quite how serious pressure injuries can be. They actually can be deadly, because what happens is that bacteria gets into the bloodstream and causes septicemia, which can lead to death. And 75% of the deaths are related to that septicemia that has occurred from these pressure injuries. So of course, again, right away, get to the healthcare provider. Surgery is often required for this type of wound. That would mean like they'll take probably to a reconstructive skin flap, where they take a part of your skin from a different part of your body and cut away the dead tissue and then replace your healthy skin over this wound after they make sure they clean it out. And healing time is extensive. It can be anywhere from 3 months to 2 years. So we really need to stop it, from the early stages, and even to prevent it from starting.
So one of those things I want to share. So if you see redness developing and it's not really going away, I mean, you might say to yourself, well, you know what, I'm just going to reposition a little bit more. I'm looking at everyone right now, and I'm telling you from experiences that if you can get out of your chair and off of that spot completely, because everyone's like, what's the best? Get off the area completely, let it air out if you can. but also whether you have to have like a computer, like I'll always have like a computer that's right there, whether it's in bed or wherever I have to go, but I won't do anything. I know it gets to be difficult and everything. I will catheterize myself. On my side, I will have a bowel routine on my side, everything that I need to do to avoid any type of pressure to that situation. This is where we get very creative, but I'll tell you, in getting creative and allowing all these to heal, because probably in about 36 years that I've been paralyzed now, I think I've had maybe 3, maybe 4. Never have I had to be hospitalized because of them. So I'm very fortunate that, because there's an understanding that, okay, I was sitting up too much. What can happen too is that if you have a cushion that doesn't have enough air in it, if you have like a Roho cushion and you're not aware of it, you're just assuming that, oh, I'm sitting on my cushion, it's fine. Make sure that you're checking your cushions if they have air or any type of distribution of air that flows through it, and make sure that it's at the right level for you, because that could be the difference. You could have one quadrant of your cushion that's flat and deflated and you wouldn't know it, but you sit on that hard substance for a long enough period of time, you will be developing a sore. So we can't tell you enough the preventative measures, but also when it starts to heal. So some of you, I know, I mean, I see it all on these chat forums and everything. You like to say, you like to post a picture, is this a sore, and what should I do? And you like to care for it at home. And if that's the case, really, really be careful with that. I know none of us like to go to a hospital or do anything, but just be very careful with your own self-care and making it happen. But there's nothing like getting getting off that area and relieving pressure. So you know what? I just need to say this too, there, and without using any kind of names, this is part of the message that I feel that I have, is that there have been people in my life who actually aren't here anymore because of a pressure sore that got infected, and the infection got to the bone, and through the infection, there were complications, and complications led to their untimely passing. So I don't say that to scare you to the point where I don't want you sitting up at all. I say that because I want each and every one of you just to think about, you know what, do I need to do a reposition in my chair now? How long am I holding it for? Am I getting out of my chair enough, or am I sitting up too long? So all these are so important about sharing with you. And we want you to understand, I hope some of these pictures are also gruesome enough to say, I never want to go there with my own care. So this knowledge is going to be powerful. Maybe this is going to be that vigilant presentation that you see that says, hey, you know what, I need to increase my care. I need to be more aware of what's going on, especially as we age with our disabilities and our skin isn't as taut as it used to be. So that's why it's very important.
Yeah, Scott, you bring up a good point. As we age, our skin starts to thin, and the thinner it gets, the more prevalent it is to cracks and tears. And also, again, if urine or fecal matter, and feces is especially dangerous because those enzymes break down the skin very rapidly. So we really, again, it's about prevention, keeping that skin dry and shifting your weight as much as possible. And this is just a view of a deep tissue pressure injury. The skin is intact in this situation. It might be deep purple, red, maroon, or a blood blister due to damage of underlying tissue from pressure or shear. Yeah, sometimes when you just move your skin, again, especially as we age, Scott, if you move your skin, it could tear on the bed. And now you may not realize it, but you're putting your body at higher risk for a pressure injury to start there. It's some of these things are difficult to predict in people with darker skin, especially just all pressure injuries. So again, inspection, like Scott mentioned, frequently checking your skin, having your caregivers do it, so important, because once a pressure injury develops, it can progress very rapidly. So this is also I've heard this talking to patients where a thin blister develops over the wound, but the wound may progress underneath, and then it's covered by a dark, thin scab, but underneath there's tissue injury, and they could get worse in spite of you think it's getting better. So always reach out to the healthcare provider.
This is all great, Beth. And again, knowledge is power. And that's what we're doing here. I meant you don't want to be shown these slides when you're in the hospital and saying, listen, this is what you're looking at happen. This is why we have to do the surgery. We want this to be a preventative presentation tonight.
Yep. And then this is, I mentioned this earlier, unstageable pressure injury. Here's where there's full thickness tissue loss in which the base of the ulceration is covered by slough or dead tissue. And it, the color could be many colors: yellow, tan, gray, green, brown, with the scab over top of the wound bed. So again, if you suspect anything, please do reach out.
And Beth, I've been reaching, I have a pouch that's right below me in my wheelchair. I've been looking for this mirror that I have, and it's all beat up and it's worn out, but this comes with me everywhere I go, and it's very small. I meant the mirrors we're suggesting have longer handles and they can contort and so forth, but I've been able to manage with this one. I have a better one at home up on my bed, but this one I travel with wherever I go, and I can see every part of my body with this. So sometimes I'll go on the bottom of my feet if I can't see them. My bottom, obviously, sometimes on my back if I've been in a certain position, much lower down because I'm a T7 injury. So these are so important. I don't mean to like reflect the light into your, I'm not one of those people, but it's very easy. So where my wallet is, where my iPhone is, I have one of these mirrors. I can't tell you, there's not a better investment that you can make. And they have great ones that actually the handle bends in all different directions. So you can see like every single spot on your entire body and check it, even the back of your legs. I mean, we're talking the knees and the side. I remember getting a little tiny sore right below my knee because my part of my calf almost, or my lower leg, was hitting the side of my chair for some reason. And I didn't know. And all of a sudden, like I felt this indentation, but then I saw a little bit of a sore. So right away, I had to make a modification to my chair, and I found out that I was sitting incorrectly. So I know it sounds like a lot that we have to do with regards to caring for ourselves. But in my head, like I can't do enough because the alternative is being hospitalized. The alternative is taking me away from my family. It's taking me away from my work and everything. And that's unacceptable to me. So if there are things that are within your control, absolutely take advantage of that, please.
Absolutely. And the Christopher and Dina Reeve Foundation, I'm going to make a shout out to them. They're a wonderful resource for information too. As is our website. If you go to Quest Healthcare or Enemeez, www.enemeez.com, we have great resources there. And Thrive, of course, is a great source to check out too, which you're on already. But here again is the picture of a tub. It comes in these little mini-enemas. Come in tubs of 30 units. And we also have a great patient assistance program, Scott, that people can reach out directly to us and help get coverage should they not have insurance coverage. But this is an over-the-counter product, so hopefully you can get it that way. Or if you're a patient with neurogenic bowel, then your doctor could write you a prescription where you may get reimbursement through Medicaid and commercial insurance plans. Sometimes your doctor may need to fight the fight to help you get it covered, but it is considered an over-the-counter product, so you can get it at Walmart or Amazon yourselves. But again, it works super quickly, an average of 10 minutes. Our labeling says 2 to 15, but it causes virtually a very little fecal incontinence, about 3% in a 5-month period in one of our clinical trials, which is far superior to suppositories. Hate to dog them, but they really cause a lot of fecal incontinence. Scott, I don't know if you're aware of that, up to 40% in numerous clinical studies. So that really does not help the skin integrity and can lead to a host of problems. But I hope you give this a try and try our 2-week free sample here. Reach out and we'd love to have you try it and see how it works for yourselves. Thank you.
Fantastic. Beth, well, this was painless, and I think it was wonderful. And we're going to do more in this series to help people with different issues that are affected by their bowel routines. And we couldn't be more thankful for Enemeez and for, again, hosting the Thrive community, but hosting sessions like this in which we're going to educate people. So again, yes, it is about education. It is about awareness. It is about prevention. And look forward to doing more with you, Beth, in the future.
Sounds great. I'll see you in a few months. Thanks. Have a great day, Scott. Take care, everybody.